My name's John, and as you can tell, I'm a Bernie supporter. Now, I've been a Bernie supporter for about a year. I did a whole lot of research on Bernie before I ever decided to support him. Quite frankly, I've never, ever supported any president. Ever. I have defended a few here or there, mostly against the people that are worse than them, but I've never actually supported any candidate for president of the United States. The only reason I'm supporting Bernie is because he's the only one who is not corruptible and refuses to take money from corporations or rich people. That tells me he has integrity. Now, the reason I'm making this video, it's because most people don't understand how the health care is going to work under Bernie with Medicare for All compared to how it works now. Many people seem to think it's going to be worse. So I'm going to compare the two. That way you get an idea of kind of like, what you're in for, basically, compared to what we have now. If you think what we have now is better than what we're going to have, you will change your mind after this video. Then I'm also going to use visual representations that will pop up while I'm talking as well, so that way you can actually see what I'm talking about, just in case you do better with visual versus hearing. Now, first of all, we have what's happening right now. Right now, you have to use doctors that are in your network. This is corporate-controlled healthcare. What that means is if you go outside your network, they're not going to pay for it, or they're only going to pay half. That's not freedom of choice. That's anti-freedom, because you can't just choose anybody you want to. Now also, rising monthly insurance costs is what goes on right now. Every 6 months or every year, our insurance goes up. You like that? I know I don't. Also, you lose your job, you lose your insurance. Definitely not a good thing if you lose your job, because those COBRA insurance you get after you lose your job, it's about 3 times more expensive than what you were paying before. Also, many policies have really high deductibles that, quite frankly, most people can't afford. That really doesn't help you either, because if you can't afford the deductible, you're going to have to file bankruptcy. Also, many policies don't even cover all the prescription drugs that are out there. They only cover some of them, which means that you could have a really expensive drug bill that you can't afford even though you have health insurance. Here again, not a good thing. We also have 30 million people who still don't have health insurance. Now, you think you probably don't care about those people. Those people are costing you money because they're making your health care more expensive because they go to the doctor, can't pay, and file bankruptcy. That's not good for any of us either. Also, millions of people underinsured with those really high deductibles that they can't afford, which means they still have to file bankruptcy anyways, which also increase the cost of medical procedures. Last and finally, high costs due to corporate profits and management pay. That just increases the amount of money that you and me have to spend on health care. Quite frankly, we don't need private companies, to pay for us to pay, who then turn around and pay doctors. The government can do that. Insurance is not creating anything. They're not producing anything. They're not servicing anything. They are literally taking from you and giving to your doctor, and that's all. Now, Medicare for All. Here's what's going to change. You can use any doctor or hospital that you want. You don't have to worry about being in network or out of network. That is pro-freedom. Means more freedom for you. Also, no more monthly insurance costs. No $100 insurance a month. No $1,000 insurance a month. No more insurance costs. Can't beat that. Also, you lose your job. Don't have to worry about it. You still have insurance. No more deductibles you have to meet. No more people filing bankruptcy because they can't afford their deductible. Also, all prescriptions will be covered. You will never have to worry about getting a prescription from the doctor and not being able to afford it when you go to the drugstore. Also, no more uninsured or underinsured people, which means the cost goes down right there because no more bankruptcies and no more people that can't afford medical bills. And finally, drastically reduced costs due to no more CEO pay to have to worry about, no more investors to have to worry about, none of that. What that pretty much means is that we're going to pay less, we're going to get better care, and we're not going to have to worry about having to not afford anything. That's all good things. Now, my next video is actually going to be about how Medicare for All actually benefits companies compared to what we have now, which I'm sure a lot of you probably want to know as well. So definitely tune into that one. Again, I am John, big Bernie supporter. Hope you support Bernie as well. Have yourself a good day.